Hi, I'm David Starbuck-Smith, and today I want to tell you and talk to you about whiplash. I want to give you some ideas of what you can do about it, because whiplash is a very serious thing. If you've been in a car accident or any kind of other accident where your head has been whipped around, now you know that the pain can come on right away, but usually it comes on hours, days, weeks, or even sometimes months later. And that's because your body has undergone a shock. It's kind of still under shock, and it takes time sometimes for the body to play that shock out. And often what happens is with whiplash, you've shifted something out of place. One of your spinal vertebrae has shifted, one of the joints has rotated, or you've thrown out a rib, or something has gone on where it's shifted your spine or your base of support. And that is a problem, because when that happens, you may not feel the pain right away, but it will throw everything else off later. You can have muscle spasms, you can have pain in specific spots, or it can just be generally tight and stiff and sort of miserable. If you've had whiplash or you think you might have whiplash, first thing is make sure you see a doctor. Make sure you see someone who can check you out, give you the green light to do exercises. Otherwise, you run the risk of doing worse damage. So make sure you see someone you trust, a doctor and a professional who can help you. If you've been cleared to do exercises and you're good to go, then I've got 3 exercises for you right here that you can do that will help release some of this tension. Because remember, with whiplash, your neck muscles lock up, your trap muscles lock up, even your mid and upper back can lock up, and even sometimes your lower back. So these exercises will help. So the first thing you're gonna need is you're gonna need a chair, and you're gonna need a wall. So a chair and a wall. And you're gonna start by bringing the chair near the wall. You're gonna stand against the wall we'll start with your left leg. Your left heel is on the wall, touching the wall. Your left foot is straight. Your right foot is up on the chair at 90 degrees. So right now my right foot is pointing straight ahead. My knee's at 90 degrees. My hip is at about 90 degrees. Your butt is gonna be on the wall, and your upper back is gonna be on the wall. Now, you wanna relax your stomach. If it's comfortable, and only if it's comfortable, you can put your head on the wall too. But do not strain your neck. If it's not comfortable, don't worry about it. Take your head off the wall, relax your arms at your sides, and breathe. Take deep diaphragmatic breaths. So inhale, let your stomach expand. Exhale, let it fall. Now as you breathe, you want to inhale through your nose and exhale out through your nose. Part of what that's doing is that's triggering your parasympathetic nervous system, your rest and digest mode. It's telling your body to relax. And it's getting you out of that tense fight or flight mode, which is often the case and often happens after a car accident or after some kind of shock, or if your body's still stuck in a scenario where it's protecting your spine and locking down those muscles. So your body still thinks it's in fight or flight and survival mode. This breathing will help. This exercise is gonna help, and I'll tell you why in a second. First, make sure you relax your shoulders. Breathe deeply into your nose, out through your nose all the way. As you're standing here, what's happening is that your ankle, your knee, and your hip and your shoulder are in a straight vertical line. Now what that means is that you're setting your spine up to be perfectly aligned as well. And that alignment then is asking your shoulder muscles, these top shoulder muscles, to start to relax as your mid-back starts to change position. So you're using the door essentially as a reference for straight, to realign your spine in a very gentle and a very even way. So you just want to breathe, keep everything relaxed, and you want to stand here for up to 2 to 3 minutes on each leg. So when you're done with 2 minutes on that leg, you're going to switch. And other leg goes up on the chair, about 90 degrees. I need to move over. Right heel against the door or against the wall. Left foot straight ahead. Relax your shoulders, relax everything, and as I said, breathe. Head can be on or off the wall, but it's got to be comfortable. It has to be comfortable, otherwise leave it off the wall. A lot of times people with a lot of neck pain, or if you've done something to your neck, then what will happen is that your cervical spine will flatten out. It'll go on lockdown as well. And that means that if you try and get an arch in it, even just by putting your head against the wall, it's going to hurt. You don't want that. Don't force the curve. in your neck. Let the muscles relax around it. Let the upper body shift and change position back to its neutral alignment. And that, as your muscles relax around your neck, the neck muscles can eventually release and relax and that curve can come back, but never force it. So just breathe. And you're going to hang out here again for 2 to 3 minutes. Okay. You'll notice as you're hanging out, your shoulders will start to eventually drop, almost like they're melting. And you want that. That's a good thing. Okay. Next exercise is you can use that exact same chair. And this time you're going to lie down on your back as long as it's comfortable. And as you lay down on your back, you're going to bring your legs up to 90 degrees. So this is a regular size chair. Scoot as close up as you can to the chair. Let your knees relax. Arms out to your sides. Now, another important point here is if your neck is not comfortable, then you put a little cushion underneath your head. You can prop it up with a cushion, a book, anything that's comfortable. A towel works as well. And you want to just put it as high as you need to for there to be no pain. And eventually what will happen is as your body settles, you'll be able to decrease the height of that pillow or that towel. And eventually you get your head on the ground. Maybe not today in this session, but you might be able to do it tomorrow or next week or even in a couple weeks. So either way, this is what you want to do. You want to get your palms up at your sides and you want to breathe. Inhale, stomach rises, diaphragm kicks in. Exhale through the nose, all the way out. You want to take about 20 good breaths here, and you can hang out in this position from anywhere from 5 to 15 minutes. This is an incredible position if you have back pain, neck pain, any kind of pain, because it's using the ground as a reference for straight to balance out your spinal muscles right to left and top to bottom. It's putting your spine back into neutral without any penalty of twisting or turning or kinking in any way. So this is a very safe, very good exercise. Of course, if anything causes pain, including this exercise, skip it. Go to the next one. Okay, but you want to do this for about at least 5 minutes. And as I said, up to 15 minutes at a time. But you just want to focus and breathe the whole time. As you do, you'll notice your muscles begin to relax. Muscles around your shoulder blades, muscles in your lower back, your shoulders, your upper shoulders and your traps. Everything will start to relax and again start to melt. And the longer you're here, the better. Okay. Now, if it's comfortable and only if it's comfortable, you're going to interlace your hands together, palms together, elbows straight. You're going to bring your hands back overhead and then back in front of you. You're just moving your arms back and forth, elbows staying straight the whole time. And this exercise is just getting your shoulder blades to start to glide and start to move. You're putting a little gentle motion into your spine. And of course, it has to feel okay to do. Otherwise, just relax and just hang out right in this position. But if you can, you're just going to go back and forth here. It's like you're jimmying loose your shoulders, your upper back, restoring some motion, decreasing tension in your neck as you go. And you want to do about 20 of these. Don't arch your back to try and get your hands to the ground. Only go as far as you can. If this is as far as you go for now, that's okay. And you're just going back and forth. You're not holding it. You're just going back and forth. When you get to 20, bring your arms out to your sides, palms up again. Take a few more deep breaths and relax. Okay, that brings us to the last exercise. You're going to need a wall or a door for this. I have a door. You're going to lean against the door. Keep your hips on the door or the wall. Walk your feet forward. Your feet should be straight, pointing straight ahead, about fist width or 2 fist width apart, not out here. They should be narrow, but not touching. Slide down the door or the wall, just short of 90 degrees. Okay, you don't want too low, but press your lower back flat into the wall. Press it flat. There should be no space between your lower back and the wall of the door. Palms up on your thighs. Weight towards your heels. Push your body into that door wall. Relax your shoulders, and you're going to hang out here. Now, I know this seems like a strange exercise to do for your neck or for whiplash, but what's happening here is you're actually putting all the work, all the stability down into your hips, into your pelvis. And what that means is that there's no more work up here in your upper body. So your upper back muscles, your shoulder muscles, your neck muscles can all relax. So when you come up, you're going to be more balanced, right to left and front to back. Those back muscles will be more relaxed. You'll be more aligned, so your spine will be more aligned. And also, that means that your shoulders and your neck can be more aligned as well, which will take pressure off. You want to stay just a minute, even 30 seconds is good, but you want to go to 2 minutes, fine, but 30 seconds to 2 minutes, plenty. Your thighs will start to burn, just giving you a nice leg strengthening here. And when you're done, you come up and close your eyes and just kind of notice how you're doing. Notice how you're feeling. You should feel looser, you should feel more balanced, you should feel better, you should feel less stressed. If you repeat this a couple times, you can repeat it 2 to 3 times a day, as long as it takes. Remember, it's got to feel good, it should feel good. If there's ever pain, skip it or stop and talk to your health professional and go from there. If you liked this video, please click like and please send to all your friends and please subscribe. And I hope to see you soon.